Okay, this is more material towards the introduction to psychology and psychological self-care. Okay, we have just spoken about kind of a multi-purpose, simplistic but elegant view of defining definition of psychology, thoughts, feelings, and behaviors, and we talked a little bit about what it's called evolutionary psychology, which means how the hunter-gatherers, how the prehistoric, supposedly prehistoric human beings and proto-human beings thought, felt, and behaved, and how psychology could be viewed from the postmodern perspective, which is probably a lot more about expectation and norms and values than it has ever been. We talked a little bit during the break about how technology complicates that. An example of that would be multitasking and stress from a lot of different environments. There is a theory that ADD and ADHD is actually some vestigial psychological, neurological dynamic whereby modern folk with ADD and ADHD might have been better suited to the hunter-gatherer environment, because ADD and ADHD people tend to do really well with hyperfocus as opposed to multi-sensorial dynamics where stimuli are coming from all different directions. It kind of, for example, when I have ADD, ADHD, when I'm hyper-focused on a topic or a concept, I'm on it. It's hard to get me off that. But when I'm doing stuff like paperwork or in a room, walking in a room with a lot of voices, I get disoriented because stuff is coming at me from all different directions. So we talked a lot about those factors. What I want to talk about for the next little bit are the barriers and the challenges to what we have to look at as normal psychology. Normal psychology, as our peer mentioned, normal psychology would be a human's, any average human, their thoughts, feelings, and behaviors, and their personality, and their interactions, and their perceptions, and their assumptions, and their beliefs, and opinions, and all the rest, and their response to stress. Is it within the normal realm of thoughts, feelings, and behaviors? And that means we're talking about cultural norms. For example, in the year 2022, if you walked up to a psychiatrist and said, I spoke with God last night, I had a running conversation with God, and we had a really good conversation, they may or may not ECO and TDO you and give you a psychiatric evaluation. 200 years ago, 500 years ago, or maybe in 1890, you might have been considered to be a prophet and you might have started your own religion. So what we see is psychology, the norms of psychology are very relevant. Relevant to time, relevant to culture, relevant to gender or sex. It's a difficult conversation these days with non-binary discussions and what have you. But the psychology of a woman in the year 1960 was suburban America was vastly different than the psychology of a woman perhaps in the year 2020 in the same suburb. You see institutions like feminism changing the psychology, which includes behaviors, of the average woman at any given historical time. So psychology is relevant. So when you're understanding your own psychology and you're trying to change your mind, which is what recovery is all about, you have to understand where you're coming from. You have to understand where you came from, you have to understand where you're at, and you have to understand where you're going. When we talk about understanding where you're at and where you've been and where you think you're going, we're going to talk about how the mind works. We're also going to talk about mindfulness-based stress reduction as a way of life to help stay safe psychologically. Lots of discussion there. In the meantime, let's talk about the barriers and challenges to quote-unquote normal psychology. Let's just say that part of recovery is to attempt to create some sort of normal psychology. Let's use the word normal. Let's stop using that word because no one wants to be abnormal or different. Let's talk about safety. The average human being wants to feel, think, and behave safely. That's normal. The average person who comes to my group may not even know what safety is, may not have experienced it ever. And moreover, and very paradoxically and interestingly, the average human being that I work with ends up conflating or confusing thoughts, feelings, and behaviors of self-harm with actual safety. People move towards drugs and alcohol thinking they are safe in some way. We had a group member talking about being stressed and being paranoid and being psychologically vulnerable, and what was the behavior that was calling out safety, safety, safety? It was relapse on drugs and alcohol and another human being. Classic. That makes people think, feel, and behave as if they are crazy. Not true. It's just not safe. So we're going to start looking at safe psychology and the psychology of safety, and self-care psychology and the psychology of self-care as being, quote-unquote, normal, and the goals and objectives to achieve. What are the barriers to thinking, feeling, and behaving safely? First of all, what does the term safe mean?
You don't feel like you're in danger.
A lack of danger. Safe, a synonym for safe is secure. And then the opposite of safety is danger or insecurity. So what are the barriers to safe and secure thoughts, feelings, and behaviors? Trauma right off the bat. That shouldn't be a surprise, because everywhere we look there's trauma lurking, or either hiding in plain sight or very, very apparent. So remember, trauma changes the way the mind, changes the way the brain works, in that the parts of the brain that are supposed to be only used a handful of times in your life, maybe, hunter-gatherers back in the day, I'm sure, used their amygdala a lot. That's the safety behavioral piece, because you probably were in imminent harm a lot more.
Not to interrupt, Willie, but you kind of got on that subject. I'm dealing with some very bad PTSD right here in the past couple months. Myself, very bad trauma.
I believe that the vast majority of people that I work with have a vast trauma history, and chances are, if you're joining group in that moment, you are in the midst of a trauma, either way of life or an exacerbation. So thank you for pointing that out. Listen up, because this is really important. So trauma changes the way the mind works. It makes the part of the brain that is reserved for pure safety response kind of on high alert 24/7, so that it doesn't, and some people really are in harm's way. If you live in Syria, your amygdala is on point 24/7, because bombs have been dropping on you for 15 years now. And in Afghanistan, it's been since, before Alexander the Great. Afghanistan as a geography has been under invasion for at least 3,000 years, probably 5,000 years, maybe more. Afghanistan is its geography is conducive to all kinds of, they're kind of like in between a rock and a hard place, always. So their culture is that they have a trauma culture, those folks over there, because they've been invaded by foreigners for 5,000 years.
That's all they know, survival.
Exactly. So trauma is a great barrier to thinking, feeling, and behaving safely. What else? What other barriers are there to our psychology of self-care and safety?
You feel like your environment that maybe you don't have
Stress management.
So on the one hand, we have stress management. On the other hand, we don't feel that our environment is particularly safe. So we've got nurture, which means our person in the setting, the human being in setting or in place or in environment. And then we have stress response. Yes, that's highly collaborative and correlated and mutually inclusive with trauma. And then we also have a genetic predisposition. Some people have a genetic or epigenetic, which means your genes have, in the last several generations, developed a propensity or a predisposition to feeling unsafe. That's an emotional dysregulation baseline. We call that temperament. We call that resilience. The geneticists and the neurologists would tell us that we are born with a certain amount of resiliency and a certain temperament. And temperament is highly associated with personality. So you are born with a certain temperament, say of emotional sensitivity or emotional intelligence, or low stress or low distress tolerance. And then trauma and your environment is added to that. You've got a very potent mix for not only poor development psychosocially, like Erickson talked about, not only not meeting your needs, like Maslow talked about, but now we're talking about your mind becomes trained to be hypervigilant towards danger and seeking safety. It gets real complicated because that's where drugs and alcohol and other dangerous behaviors, like inappropriate relationships, and then defensiveness and aggression and anger or depression and anxiety start kicking in. Now all of a sudden your psychology, not only were there barriers, but your psychology, your thoughts, feelings, and behaviors in response to your setting and stress response, all of a sudden starts looking like a one-trick pony. Everything sends you to emotional dysregulation. Everything sends you to cognitive disarray. We're going to call that cognitive distortion, which means you start believing things that just aren't true about yourself and the world. And then the behavior really starts becoming impulsive knee-jerk. So you see people who develop and evolve into predictably unpredictable people. The people who don't care about psychology or don't bother with it, aren't mindful of it, which is to say many people in society, we call them casual observers. When you think, feel, and behave erratically or unsafely, you are marginalized into a group of dangerous people. Antisocial, drug addiction, anxiety, depression, trauma, serious mental illness. You are marginalized out of the mainstream. And then you feel really badly about yourself because nobody likes to be anxious, depressed, on drugs, or reactive. Nobody likes their personality disorder. And then once you get marginalized, it's very difficult to get back into the mainstream. That's why it's imperative that we aren't here. We understand we're not just here to quit drugs and alcohol. We are here to understand our psychology so we can change our minds and then we can fit into society comfortably. It takes a while to be comfortable. That's a huge part of this. If all you do is stop using drugs and alcohol, you're not going to automatically feel comfortable in society or in your own skin. That's another definition of psychology. How I think, feel, and behave in my own skin. When it's just me in a room managing my life. Or just me in the car driving down the highway managing my life. Very important. Drugs and alcohol as a behavior are part of our psychology, but it's just a part. So recovery really is about coming to terms with our psychology, our thoughts, feelings, and behaviors in environment, but also in isolation, in the ego, and changing those dynamics. And that takes a while. It also takes insight. And we start talking about things like acceptance and commitment. You have to accept that there's a problem with your psychology on your terms, that you understand your psychology and you understand the problem and you accept that, and you accept that there is a way to change your mind, and then you commit to the program to change your mind. It's called acceptance and commitment. You throw determination in there and then now we're really cooking. In fact, there's a modality called ACT, acceptance commitment therapy, that a lot of places use, and let's not confuse that with some brand new technology. Those are concepts that have been floating around for thousands of years. Accept where you're at, and in order to accept where you're at, you have to reconcile denial, and then commit to a program or a way of life to change how you operate. We call that morals and spirituality and values. We call that recovery, acceptance and commitment. So when we talk about our psychology, and we talk about the barriers to our psychology, people, places, things, bio, psychosocial, spiritual, the whole enchilada, we automatically then start talking about the solution, which is a mindfulness-based stress reduction program of self-care and a commitment to holistic wellness. So the barriers lead to the solution, or the problem leads to the solution, and then we get to wrap our minds psychologically around the great maxim, the Buddhist maxim, for example, that the barrier or the obstacle in the path is not the barrier or the obstacle, it is the path. It is just part of the path. We accept our historical psychology of abuse, neglect, trauma, whatever, PTSD. We understand that. We understand how it has created problems in our lives. It would be great if I could time travel back and reach you all as children. Wouldn't that be cool? We headed off to the past. But here we are as adults having to reconcile it, and that's the acceptance piece, and then we move out of the commitment piece. If you only accept and you only have insight and you don't do anything about it, what does that mean? It means you're going to be a tragic statistic. Wisdom means you gain insight and you put it to use by changing your thoughts, feeling, changing your psychology, by changing your mind. That's what wisdom is.
Is the alcohol and substance abuse, is that a barrier or is that a response to a barrier?
So a great paradoxical question from a peer in the group. Is the behavior of substance abuse, which leads to substance use disorder, is that a barrier to our psychology, or is it a result or a symptom of our psychology, our thoughts, feelings, and behaviors? I would ask, is the chicken or the egg? And we would go from there. My view vacillates from, it's symptomology, which means it is a result of that the seeking drugs and alcohol, the behavior of seeking drugs and alcohol to, theoretically, but I think this is reality, so to speak, to self-soothe, make suffering go away, to make ourselves cope with thoughts, feelings, and behaviors. I think for the average person, the drugs and alcohol came later. However, once you're in that dynamic, do the drugs and the alcohol influence and become a barrier in and of themselves? So the answer is both. And that's the problem with with a lot of interpretation of dual diagnosis, which means, for example, PTSD or OCD with the predictable substance use. A lot of people, a lot of patients, a lot of clients, a lot of individuals, they say, my drugs and alcohol, that's a symptom of my mental health, so all I got to do is take care of my mental health and that'll all go away. Well, not if you become physically and emotionally dependent on the substance. It's created its own vortex and its own gravitational pull. It's its own thing. It has its own orbit. So we really do have to, and this is a great segue, we really do have to take both into consideration. And the beauty of it, as we learned in the trauma and the dual diagnosis piece, is that the symptoms and the behaviors and the dynamics are so similar. Thank goodness mindfulness-based stress reduction gives us a set of tools that we apply to both, to all of our problems, whether it be substance use disorder, the actual cravings of drinking and using, or whether it be stress response that is more purely emotional and cognitive, if that makes sense. The true value of mindfulness-based stress reduction, which ACT, by the way, is based off of, is that it gives you a way of life and a set of skills to feel, think, and behave well regardless. So that's a great place to end this segment, because it opens up a discussion about mindfulness, both as a way of life and as a tool set to address, from a psychological standpoint, to address our thoughts, feelings, and behaviors, which means mindfulness can help us quit drugs and avoid relapse, but mindfulness can also help us address cognitive, emotional, and behavioral elements of trauma and the human experience that are that are somewhat independent of drugs. In other words, mindfulness is a great way to go about your life once you've quit drugs, because it'll help you stay off them, but it'll also help you carve out contentment and peace of mind and safety in your thinking, feeling, and behaving 15 years since your last use. Excellent.